Alison Tierney, thank you so much for joining us on the Plan Trainers podcast today.
Thank you so much for having me. It's such an honor to be here.
Do you have a moment of gratitude to share with us and the listeners?
Yeah, I absolutely do. I've been thinking a lot about one of my patients lately who's actually a stage 4 metastatic breast cancer patient, and she just had brain surgery. But my moment of gratitude is that the surgery went really, really well. Her recovery is going amazing, and her recovery and her story that she shares is just so inspirational to so many people. So I'm very, very grateful and have gratitude for that whole journey that's going on for her right now.
That's beautiful, and I'm sure that she's grateful for you and the part that you're playing in that as well. So
Yeah, I'm
I'll
super
put that
honored to
out
be
for
part.
you.
Yeah, I'm super honored to be part of her support system and her team.
Beautiful. So what we're going to talk about today is going to be interesting, I think, for everybody. We want to talk about fertility or maybe even infertility in women and how that's affecting mental health and physical health, and even how that extends to the partner and how that's affecting the partners as well. What are you observing today in terms of big trends in infertility?
I think one of the big trends in infertility is the fact that we're learning more and more about people that are experiencing infertility. And I think that could be for a lot of different reasons. It could be because of the lifestyle that many of us are living that is leading to more negative outcomes when it comes to fertility, but also that I do think that we're in an age where people are more willing to share what is kind of going on with their journey, and we're becoming more aware. The chances are is that the listeners listening to this show, either them themselves have dealt with infertility, or they know a family member or friend who has gone through it or is currently going through it. So it's affecting so many more people than ever before.
I remember the first time that I really interacted with a friend who was going through infertility issues. And, we're blessed. Our children came very easily to us when we were ready for them. And I experienced postpartum depression after both children. But after my first, I met a friend for lunch when I was back in town. And we were talking, and I was sitting there crying and crying because I was having this postpartum depression. It was so hard to deal with not being at work and having the baby and all these emotions that I couldn't control. And then she started crying, and I couldn't understand why she was crying. And she was crying because I'm crying over the fact that I have this beautiful baby and I don't know how to deal with this. And she wants more than anything in the world to have a baby, and she spent thousands on different procedures, and the baby still wasn't anywhere to be seen. So, it's difficult, and you don't know what other people are going through because it's not something that you wear on the outside.
Right, absolutely. And some people are more willing to share their story than others. And I think whatever form that someone chooses is absolutely fine. I've chosen to share my story if it can just help one person or one couple experience the joy of having that child that they're working so hard for, then that's totally worth sharing their story. But at the same time, it's everybody's own individual journey. And I don't think there's one right way to feel about it or have emotions about it, because even if the journeys are similar, everybody's journey is different, and how they get there and how they go through it and what treatments they may or may not choose. And I do think it's also very hard for someone who maybe hasn't gone through it to know what to say, know how to support that person, because the feelings that you are having as well, and then postpartum depression are very real and very difficult. And they're two very different feelings and emotions, but both of them are valid and acceptable.
You said there were a lot of factors that play into infertility or fertility either way. Are there any factors that are bigger factors than others? Like, does one affect people more often? Is it the age or the lifestyle or the diet or stress? Is there one that's proven to be a major factor compared to the others?
Well, I think that's a really great question. And I'm not sure that research has really come out to say, like, this is the one thing. However, we do know that fertility is very multifactorial in the things that you already mentioned in terms of age, diet, lifestyle, mental health, and stress. Like, those are all pieces of the puzzle. And as a dietitian, of course, I always talk about food. I believe that's my scope of practice. That's my realm. But also, as somebody who's gone through infertility, I know very well that the lifestyle lifestyle and the stress all play a role as well. But I think what I want to say about this is that diet plays a bigger role than a lot of people think it does. It's often downplayed that your diet doesn't play a role, but we're learning more and more, and the research is there to show that what we eat drastically affects our hormones. And as you know, hormones are a huge piece of reproductive health and the ability to conceive. So diet plays a bigger role than most people are aware of, and part of that is because it's not really talked about. And thankfully, we're seeing more people talking about it, especially physicians, as people go through their fertility journeys. But it's still something that needs to be talked about more because it plays a bigger role than a lot of people think it does.
So maybe this is a good time, if you don't mind, to share your journey towards plant-based nutrition and your fertility.
Yeah, absolutely. I'd be happy to share that. So my journey really started way back, I actually went to school for business, and that was kind of the family thing to do. I always loved nutrition, but my passion about nutrition mostly was in sports nutrition. I was a college athlete, wanted to know how nutrition could fuel my performance. And so that's where it started. But I was in college, I was playing softball, and my mom was diagnosed with breast cancer when I was a freshman. And it was just a couple weeks into my softball season as a freshman, and I started to have these different mindsets about nutrition. What could my mom do during the course of treatment to help her? What could happen, after treatment to help reduce the risk of recurrence? So it kind of started there. And then as, college went on, I was still interested in improving my performance, but I started to have this love for nutrition. And my boyfriend, now husband, was a science major, and he's like, "Why are you not in school for nutrition?" And I thought that it was, number one, too late, which I was a young, 18, 19, 20-year-old, got in college for the first time. I thought that the family thing to do was go to business school, so that's what I was doing. But then my senior year, my grandfather was diagnosed with liver cancer. And all these questions arose, and I started thinking more about cancer and chronic disease, how nutrition played a role. So ended up happening, graduated with my business degree, moved back home, tried to figure out what I was going to do next with my life. And my boyfriend, again, now husband, says, "You should really consider going back to school to be a dietitian." And I said, no, it's too late. He's like, "No, just really think about it." And so I thought about it. I looked into a program, and right then and there decided I'm going to do it. I'm going to go to school to be a dietitian. And right from the get-go, I knew that I wanted to focus on oncology nutrition and working with cancer patients because of the family experience that I had. So I went through school focusing on oncology nutrition, graduated, got an internship with a well-known national cancer center, and then just started looking into the research a little bit more because I wanted to know, how could I best serve my patients? How can I help them in their treatment, and how can I help them post-treatment? And I was learning more and more about the plant-based diet, which we didn't learn all that much about in nutrition school. And so I started preaching and practicing this plant-based lifestyle with my cancer patients. And I thought to myself, why am I not doing this a little bit more for myself? And I had a relatively healthy diet. It wasn't full of fast food or going out to eat, but it was kind of more of your standard healthy, where it still included dairy and more like chicken than fish, or more chicken and fish, etc. So that's kind of where it started in terms of helping my cancer patients, and then started implementing that for myself. And during that time, I had really horrible acne in my, especially in my mid to late 20s. I was still experiencing that. But then when I decided to ditch meat and start slowly moving dairy out, my face started improving. And that's where the first personal connection was really, really starting. But during that time, in the midst of it, my husband and I were trying to start our family, and we were not having success. And so we reached to a point where it was, okay, we either move on to something different in terms of more treatments, et cetera, or, I did my research, and I was like, I really want to try the plant-based diet exclusively to see if it can help our fertility. And the way I approached my husband about it was, I don't need you to do this with me, but I would like your support in it. And he said, hands down, whatever you need and whatever you think will help us, let's do it. And so even though I had slowly been moving things out, I made the commitment to focus on a whole food, plant-based diet exclusively. And I can really happily say that just 3 weeks later, I ovulated for the first time, and we became pregnant with a beautiful baby and we had a very safe, healthy delivery pregnancy. And now she's 3.5, and we raised her on the plant-based diet as well. She is thriving, and my acne drastically cleared up. My doctor kind of didn't understand how I got pregnant. And so there's lots of really great things about it. And that's kind of what led me to continue to pursue plant-based nutrition as a healthcare professional, but also as an individual.
That's a beautiful story, and congratulations on your adorable little one. So, did you do anything else? I know people are probably wondering, did you do anything else in that time that could have helped contribute? Like, were you supporting yourself with other herbs? Did you end up having any fertility treatments, or was it exclusively plant-based?
Great question. So during that time, I was on the medication metformin. So metformin is actually a medication used for diabetes to help control blood sugars, but it's also one of the first lines of treatment for PCOS. And we can kind of get into that a little bit as well, but it's because of insulin resistance that is found in most individuals that have PCOS. So what actually happened during that time is I was on metformin, and that wasn't really doing anything or really helping. So then my doctor put me on something called Provera or progesterone that stimulates a period because I wasn't getting periods. In that entire year of trying to conceive in 2015, I had 2 periods the entire year. So I was definitely experiencing what's called, a lack of ovulation and therefore not getting a period. And so they gave me the Provera to stimulate my period, and then take a medication called Femara, which is also used in breast cancer after treatment for hormone positive cancers, but it is used to actually help stimulate ovulation. So I used those medications, and during that first cycle, I started bleeding and having a cycle very early and not when we expected it. And, called my doctor and told them, they're like, "Are you sure this is a period?" And I'm like, "It very much, it has all the symptoms of a period." So they said, "Okay, we can't do another cycle because it's too close to where you are right now." And so it was another cycle with nothing but the metformin. And that's where I thought, you know what, I want to try something different. So I was not on those medications, the Femara or the Provera, for this next cycle. And that's where the plant-based diet was induced. The plant-based diet, I believe, played a big role in helping to conceive. I wasn't taking any specific supplements. I was focused on a healthy lifestyle outside of that. As a college athlete, I've always been into exercise and movement, and that certainly played a role and was a piece of it. But yeah, nothing very specific outside of that, but there are supplements that have been shown to be helpful in PCOS. Acupuncture has also been shown to be helpful in infertility and PCOS. So there's multiple other things that can be done to help achieve pregnancy in PCOS.
So let's take a little step backwards and let's explain Polycystic Ovarian Syndrome, or PCOS, to the audience.
Can you say that question again? I'm sorry. My Siri kind of popped up and I couldn't hear you for a second.
No problem. Let's take a little bit of a step backwards and explain PCOS so that everybody who has not heard of it before really understands it.
Sure, absolutely. So PCOS stands for Polycystic Ovarian Syndrome. Now, it's kind of a misleading title because it suggests that individuals that have PCOS have polycystic ovaries, meaning there's many cysts on their ovaries or they have enlarged ovaries. Not everybody that has PCOS has this as part of their syndrome. So it's kind of categorized in lumps. There's a big lump sum of symptoms that kind of fall into PCOS. Not everybody with PCOS experiences all the symptoms. It's kind of like this spectrum as well. So individuals that have PCOS, it was first led to believe that cysts on the ovaries were the cause of this infertility or lack of ovulation. But we learned later down the road that it's actually excess androgens or male hormones that actually start leading to this syndrome. And so it's very normal for women to have small amounts of these androgens, some testosterone. Just like men do have some estrogen, women also have some testosterone. But what happens is it's really related to excess. And I talk about this so much with even my cancer patients as well, as so many chronic diseases are related to excess of something. In cancer, excess, maybe estrogen, IGF-1, so many other things that are related. When it comes to PCOS, excess androgens or male hormones. And what that can cause is it can lead to a variety of different symptoms. First and foremost, infertility, lack of ovulation, irregular periods, or also very heavy periods for some women. It can also lead to unwanted facial hair, like dark hair growth for the female, not just on the face, but also in other parts of the body is possible because, think about where men, tend to grow hair that women typically don't. Those excess male hormones are producing some of that. It also can lead to male pattern baldness in females, where they start losing their hair in certain areas that a male would as well, and acne. Acne was a huge thing for me. That's what I experienced a lot. And then also those polycystic ovaries can be a result as well. So it's kind of a cluster of all these different symptoms that can be related.
So many different ways. So how does somebody know if they have it?
I'm really sorry. My Siri keeps acting up. So I didn't hear. I just closed it though.
No worries. So how does somebody know if they have PCOS?
That's a great question. So there's not one specific diagnostic test that someone might undergo to see if they have PCOS. Some physicians just diagnose it based on their symptoms. If they fall into the category of the symptoms that I described and have a certain number of them, their physician might diagnose them with PCOS. Otherwise, there's a series of diagnostic tests that someone would have to undergo, such as blood tests, maybe an internal ultrasound, or a look at someone's ovaries using an ultrasound to see if they are enlarged or polycystic, et cetera. So there's not one specific diagnostic criteria, but there are several different tests that can be performed.
Is it acknowledged to its full extent within the medical community, or is it something that is more on the holistic spectrum, like an adrenal fatigue kind of thing?
Yeah, it's very now well known in the medical community, but what's not well known about it is what causes it, what the best course of treatment is for people, and several of those pieces. So a lot of times the physicians will diagnose somebody with PCOS, but not really know what to do with them next. So it's still like an unknown thing in the traditional medical field in terms of what to do, but it's very widely known and diagnosed now.
How often are you seeing it reversed, or does it become reversed completely and it can kind of disappear from all the testing, or can we just alleviate a lot of the symptoms based on a plant-based diet? I know one of my clients that did our 28-day plant-based program within 28 days got her cycle back for the first time in years. So, I've seen it happen that quickly. Was that a once-off? Tell us a little bit more about that.
Yeah, that's a great question. I don't know that there has been found to be true reversal. However, the way that I like to think of it is more of a silencing, because I do think that if, that individual that reversed all their symptoms in those 28 days, if that person were to go back to their normal health, their normal lifestyle, they would probably likely see those symptoms come back again. So I do believe that it can be completely controlled and silent, or what we kind of think as in remission. We don't see the diagnostic test coming up with that anymore, but that person could, going back to those traditional habits, might experience those symptoms again. It might not be completely gone. So I don't know that there's any data to show reversal. However, just like you mentioned in that story, there's so many case studies and observational studies to show that individuals that apply a plant-based diet, also focus on other healthy lifestyle features, are able to reverse those symptoms or keep them at bay.
So what are the other things that they could do? So we said change their diet, so eat more plants, go more whole food plant-based. What other lifestyle factors could they change, or what should they be doing to help manage or get rid of this situation?
Yeah, absolutely. So there are several different things that can be done. The plant-based diet is always one of my first and foremost go-tos. We can always talk about the different features of what the plant-based diet can do, but exercise is also a big key piece of that. And the reason for that is because insulin resistance is often that underlying feature. So so for example, I am at a healthy weight. I've always been at a healthy weight, but a high percentage of individuals that are at a healthy weight and have PCOS can still have insulin resistance. So even if someone is at that healthy weight, trying to improve insulin resistance is something that's really important. And diet plays a huge role in that. And exercise can also improve insulin resistance as well. So exercise is important. Stress management, because we know that when we're under a lot of stress, anxiety, et cetera, it can increase certain hormones and therefore like cortisol and start throwing other hormones off. It's really this like spider web or interconnected web of hormones. When one goes up, another could go down. And, when one hormone is off, several other hormones can be off as well. So stress management is an important feature of that. I do think some supplements can be helpful. For example, one of the first ones I look at with a lot of my patients is vitamin D levels, because there's research to show that vitamin D can impact hormones and fertility as well. So I want to know where my patients are in terms of their vitamin D levels. Other supplements that have been shown to be helpful is something called inositol, and that's a type of B vitamin, but has been shown to be low in individuals with PCOS. So the proper ratio of inositol can be helpful as well. There's a lot of other ones that might be considered, but those are kind of the forefront of what I think about.
Can people be tested for that vitamin B level separately to know if that's something that they need?
Yeah, so vitamin D, like D is in dog,
Yeah.
but yes, you can test get your blood tested of your vitamin D to see where you're at. And this is something that I recommend people of all sorts to be checked on, because it does impact other chronic disease health, including like breast cancer health and so forth. So you would get it tested at a lab through your physician putting an order in, and you would get back your results. And depending on where your results land, you may be recommended a supplement, because the sun is the best place to get that vitamin D, because we actually use the sun and then it's converted by our kidneys into a usable form of vitamin D. But some of us don't get enough sun. I live in Wisconsin, and we only get those UV rays certain times of the year. But also, if we're wearing sunscreen, which is important to protect us against skin cancer, we're not creating that vitamin D. So we kind of want to know where they're at. And I've worked with patients all over the country, Hawaii, California, who are in the sun frequently, but they still have low levels of vitamin D. So it's a very individualistic approach to have that checked out before you start a supplement.
Yeah, and people are wearing long sleeves and we're wearing a ton of sunscreen. And so we're not actually most of the time getting the right sun at the right time onto our body. Absolutely. There was something else that you had mentioned before that I wanted to ask about in terms of when you are, I don't remember now.
So yeah. when I saw that we were going to be talking about PCOS, I was like, okay, that's great for all our women listeners. But I was thinking, like, for all the men that are listening, why is it so important for us to really understand it if it's only affecting the female? And I liked the response that you had before we started recording. So maybe you could share that so that our males, the men on our listenership, can get a better understanding of the importance and how it affects everyone.
Yeah, I think that's a really great question. So even though the female is the one that's truly diagnosed with the PCOS, and although there are male factor reasons for infertility as well, when we're talking about PCOS, and especially when it comes to trying to achieve pregnancy, this is so much related to the couple's journey to try to get pregnant. And even though it's not the male physically that's involved in this, he's very emotionally involved in this. And, I see my husband, the journey that we have taken, it's not easy for him either. And sometimes maybe even a little bit harder because he has even less control over it, right? Me as a female that has PCOS, I can think about, okay, I can exercise, I can eat this diet. Like these are things that I can actively control, where he can't necessarily do though. Now we do know that the male diet plays a huge role in fertility as well, more than we ever thought. And he can be that emotional support to help me do those things. But it's his journey as well. It's our journey as a couple to try to achieve pregnancy. And that can be incredibly emotionally draining. And sometimes it can even tear some couples apart because it's so emotional, but hopefully it brings them together even more. And just speaking for my husband, is I know how much of an emotional toll it's taken on him too, because he wanted to be a father just as much as I wanted to be a mother. And there was that big gap in the middle that we were trying to achieve together. So I think that it's important for men to know that. And even if you're not necessarily seeking pregnancy, PCOS can affect PMS. It can increase the risk of heart disease, early stage endometrial cancer, also even like depression. So these are all things that affect a woman physically beyond pregnancy, that therefore can affect your relationship with your husband or your spouse or your significant other as well.
I think that's an excellent answer and really important for people to understand. And going through, before you were talking about the stress release techniques and having that help, I think it's important for the man and the woman, or both people in the relationship, I should say, to be going through those techniques alone, because you feel the stress that the other person feels too, right? It brings it up. And that was getting back to the question that I forgot before. As you're talking about stress, do you find that there is a correlation, or is there a higher incidence of PCOS with women with mental health issues or mental health diagnoses, or maybe trauma from younger ages? Is that a trend?
Yes. So anxiety and depression are higher rates in women that have PCOS. From my knowledge, we don't know the actual reason for it. Is it the PCOS that causes the depression and anxiety, or is does the depression and anxiety play a role in influencing PCOS related to its hormones? However, I was actually just recently speaking with somebody who was doing her PhD research in this exact thing, was PCOS and depression. And, I had mentioned to her, I've always just kind of assumed that it was somewhat related to the imbalance of hormones. And she had mentioned in her experience, in her research, is that was definitely a certain part of the issue, is that because your hormones are off, that can also lead to some like your neurotransmitters to be off, and can lead to those mental health issues as well. And, to be completely transparent, I've definitely struggled with those things in my past. So like, experiencing those two together, I know there's a lot of women that do experience the mental health, because then you pile on, if you're trying to get pregnant, the emotion and the stress and the disappointment that may come month after month after month, and it just kind of adds and piles on top of it. So not only is it a difficult physical journey, it's an extremely difficult emotional journey as well.
I can see that for sure. What age do you start to see it popping up? Is it in teenagers coming up now too, or is it more being diagnosed in, more of those fertility stage ages because people are trying to get pregnant and then go figure out why? But at what age physically are people starting to get this?
Yeah, so I would say that most people are being diagnosed with it when they are trying to conceive and are unable to. But I can tell you from my personal experience is that I showed symptoms of PCOS very early on as a teenager, pretty much when my cycle began. And it was really because, ever since my cycle started, it was very irregular. I noticed that I had the dark hair growth as a teenager that a lot of my friends didn't have. And it made me feel even more insecure about myself because, of the dark hair growth that so many other girls didn't have at that time. So it does start very young. I was actually just reading a research article that talked about how there's a belief that it may actually start in the womb because of a presence of a particular hormone that may be higher in the mother. I think there's still more to learn about that, but it is very interesting to think about the fact that it could be started that early, but displayed until the woman hits their menstrual cycle.
So a lot of great information and important information that you're sharing. And for anybody that's going through the difficulties of fertility or that they're infertile for whatever reason, our hearts go out to you. And there's always people to speak to and places to go to get help. Allison, if people are looking to get help from you or want to connect with you, where would be the best place for them to reach out?
Yeah, absolutely. So they can definitely find me on social media, where I am presenting a lot of tips and tricks and lifestyle, and just creating a community for support, whether it is PCOS or cancer or other chronic diseases. So I'm on Instagram at Wholesome LLC. And then I'm also on Facebook at Wholesome LLC as well. And we do have a website, which is wholesomellc.com. There I present a lot of nutrition information and research. And one of my goals is to present that information in an easy to digest manner, pun kind of intended. And also from there, we have a free 5-day plant-based guide for, breakfast, lunch, and dinner, snacks to help them, incorporate more of a plant-based diet into their journey. And I do offer individual counseling as well to somebody who's seeking more of that individual session to help them with PCOS, infertility, or any other chronic diseases like cancer that I talked about too.
Beautiful. And we will link to all of that in our show notes at planttrainers.com. If you could leave everybody with an actionable tip of where to start today to improve their health or improve their fertility, what do you recommend?
Yeah, so my biggest thing that I recommend, especially for individuals that might not already be plant-based, is I always like to think about adding before necessarily subtracting. So, a lot of people that, they want to transform their health, but they're not ready to get rid of certain things, especially dairy. I live in Wisconsin, the dairy state, right? That's a really hard thing for a lot of people here. I really want them to focus on, okay, let's just start adding more fruits, more vegetables, more whole grains and legumes, because the rest will start falling away little by little. And the benefits that you'll feel just simply by adding more of those things to your diet might be the encouragement enough for you to start limiting or eliminating those things as well. So start with adding rather than necessarily subtracting.
It's a great strategy. We buy into that strategy too and share that. That's the best way to go. We really appreciate you taking the time to be on the Plant Trainers podcast. Thank you so much, Allison, for being here today.
Thank you so much for having me, and for all your listeners. It's been great to be here.
Thank you so much.